Hey family, welcome back. It's Dr. Anthony Balduzzi. I am joined today by Mike Mallory, founder of Rad Roller, and we're gonna be using some really cool tools to address knee pain. And this is essential because as we get older, like most of us are gonna experience some degree of knee pain, but there's some simple things that we can do to actually work on the muscles around the knee to open things up. And this hits home personally for me. On my right leg, I've had 6 surgeries on my knee and my femur. I have some pain and tightness, so I wanted to bring Mike in to help me, and you get to benefit from seeing how we're going through this process. So Mike, break down why people don't think about knee pain the right way and how we can actually kind of like attack it and release it properly by understanding the whole structure.
When we think about knee pain, and especially this kind of patellar tendon type of pain, you got to release that quad, and more importantly, you got to release all the muscles that essentially do the same motion. So if you're just releasing one part of the quad, yet the rest of it's tight, it's probably not going to go anywhere, you know?
Okay, so let's start. Let's get into a little bit of routine, and this is something you can follow along with some tools that you might have. What do you want to start with?
Let's start with the axle.
Okay, so axle is the Rad Roller foam roller. The reason I like this personally is because one, it has this indent space that's good for my spine. My leg also fits in there, and the ribs are really nice for a tactile sensation. Where am I putting this?
So we're going to go just total bread and butter move right on the front of the leg.
Okay,
so you want to go right above your knee.
Okay, so I'm
not
there.
on the joint. And then you want to probably come down to your elbows.
Okay.
So lower your upper body down a little bit.
Okay.
And then you're just going to kind of chill there. So we don't need to film the whole thing, but ideally I'd like you to take about 2 minutes to go all the way up that leg.
Okay, so as I'm doing this, and I think that's an important thing that people understand, the speed at which you move. I'm not just like hammering on it like this. I'm going a slow area, and I'm hanging there for a little bit. And I actually think wiggling side to side, at least for me, feels good. Like I'm almost thinking like zones and then moving up. And I also think I like this idea of doing a slight hammy curl feels relevant too in those areas. That's just important. I'm feeling in areas that's tight right now.
Totally. I mean, you know what you're doing here. If you're a beginner starting out, just go ahead and relax. If you're not feeling too much there, you want to add a little bit to it. He's adding a little shear by moving that leg up and down.
Wow. Okay, that feels great. So I'm going to roll the quad all the way up and down. What's next?
Let's work on the adductors.
Okay, tell me what an adductor is, because like I thought I only had quads and hamstrings.
Yeah, so adductors are essentially the groin. You've got this huge area of muscle tissue. If you grab your inner leg, you'll feel how big that actually is.
Yeah.
It's a very important muscle group. It attaches kind of all over the inside of the pelvis, and it helps control motion, it helps control rotation, and it's very important for this because if we're not releasing the adductors, we're not going to get the full benefit of that quad release. So we're going to give you 2 quick ways to do it. Okay. Number 1 is go ahead and take a 90-90 stance.
Okay, kind of like this, and like this.
90 degrees, 90 degrees.
Okay.
Bring that leg out. Yep. And I want you to bring that all the way up to the base of the pelvis.
Yeah, I'm there now.
So you're going to get a little more bang for the buck if you're right near the aponeuroses.
Yeah.
So the aponeuroses is where the tendon essentially blends into the muscle tissue. You could just release that spot and you'll probably get most of this benefit.
And that's fascinating because like that's a key point I want everyone to take home. When we started the quad rolling, we hit down here, the aponeurosis, where like the quad tendons are blending into the patellar area. Yeah. Here, I'm also starting up. So like take home point, like I'm just really drilling this home, work at those high junction points first, get the release, because neurologically, that's where there were a lot of tensions being sensed. And then
there's more sensors up there. Yeah.
Okay, so I'm still doing the same thing. This idea of just kind of rocking your weight slowly feels good. And then again, just progressing down slightly through there. There's a tight area right there. I shifted my hip a little bit, I'm on it. And so like that, I need to work on that.
Yeah, and I see you intuitively doing it, but yes, you want to roll around to kind of find what's going on in that tissue.
And I'm there. It's a hot spot, like, kind of like 6, 7 out of 10 in intensity. And I just breathe and relax.
So that's with the standard foam roller. Do you want to show them with the Rad Roller on the block? This is a little more intense version, but it's a little more straight to the point.
Okay.
Which I like.
So cool, because we have this block, but also the Rad Roller setup's amazing because these are modular and they can fit in for applications. For this, we're looking for elevation, so we're gonna go here, right?
Yeah.
Okay.
So basically, take the block first. You're going to go back to your 90-90, and you're going to stick that block, hang tight. Okay. So basically, your sit bone could sit on the block.
Okay, I'm there.
Yeah. Now lift up and stick that rad roller right there. So again, we're going right up at the edge of the pelvis.
Oh yeah, that's there, right there.
And you'll kind of feel it where the muscle gets a little bit stringier.
Yep.
And again, you know, you want to just kind of rotate around gently.
Yeah.
To find that kind of 5 out of 10 spot.
And this is interesting because like as we're doing these routines, the tool you use is like makes a significantly different experience. They're both good, but this is a lot more focused. And I actually think particularly what I would do using these two tools is I would start with this because I feel like it gets into that area a little tighter, and that felt good more on the belly of the muscle. But like if you're just trying to conform all these motions to one tool, you're missing out. And this is powerful.
Yeah, and different time and place. You know, you want to use a softer or bigger roller if you're sore. Like you can't do this. This would kill you, right?
Yeah, good point. Good point. Okay, so I work this adductor now in kind of using in these two different kinds of tool setups, and I can work all the way down.
Yeah, you want to follow it all the way down. So we did the inside of the leg, we did the middle of the leg. Now we want to do the outer portion of the leg. So we want to work on the Tensor Fasciae Latae.
Okay, what is that? I know it's like abbreviated as TFL, people say, like, What is that muscle? What does it do?
So that's essentially this fan-shaped muscle that links up into the IT band.
Okay.
You know, you'll find it, if your hip bone's here, if you go 1 inch out, 1 inch down, then you can actually rotate your leg.
I feel it. Yeah. This internal rotation, I feel it light up right there.
You'll feel it poke out.
Yep.
Yeah. So that's the spot we want to find.
Okay.
And basically, you're going to take that rad roller, stick it right where your fingers are.
Okay. I'm going to come down actually on this side just so I don't crush my microphone. Okay, right here. Boom.
So you're going to come down on the side. We're going to take that bottom leg and bring it up towards your chest.
Oh, yeah.
Because that's going to relax that muscle, take it off tension.
Yeah, that's subtle.
And then just sink in.
So this is an important point. Rolling that TFL is bringing this low knee that you're working up, because I feel like I can just penetrate so much more deeply. And again, bring my shoulder and rotating far forward here. This feels good. I mean, playing around on both, and I'm putting this hand down and I'm kind of modulating the tension through these subtle shifts, and this is good.
And this can be a really tight area. So again, you know, I'm going to be like a broken record. Breathe, relax. And if you're starting to hold your breath, just move out of that area.
And I think this is something important. If you've seen people at the gym, or maybe you've done it yourself, and you're taking this big broad foam roller and you're going up and down the side of the leg on your IT band, the IT band is not a muscle, it's connective tissue. And there's probably some benefit to doing that, no doubt. But like working upstream first is a much smarter idea. And like I know for me, I've actually had the IT band on my right leg cut surgically when they were doing some knee surgery stuff. So it's like, I have knee pain when this muscle flares up. So if you have knee pain, work this sucker.
Totally.
Okay, nice. So basically our addressing of the knee pain, we started with the quad at the aponeurosis down here. We worked our way up with maybe some shear motions. We got into the adductors starting high going in, and we're ending with some TFL work. Is that it?
That's a triple threat.
Triple threat. I love it. Thank you, Mike. This is super cool. And again, I think it just comes down to having the right tools, right? So if you want to check out some of Rad Roller's tools, you can go to radroller.com. And if you check out with promo code FITFAMILY, you're going to get discounts on our products. We also have them on our store. So I hope this really helped you. And obviously taking care of your knees is essential. You lose your mobility, you get in pain, your quality of life goes down. 5-10 minutes a day of this stuff. I mean, I couldn't imagine not doing a little bit of this prehab work before you train, or even when you're watching TV or Netflix or a movie. Like, get these tools, keep them in your house. And we'll have more videos on the channel as well showing how to use great Rad Roller tools. Thanks again, Mike. Appreciate you. I already feel better.
My man.
All right.